Some of the state's top doctors are refuting an article from Forbes that claimed that the risk of catching coronavirus in Georgia has gone up significantly in the days since the shelter-in-place order ended for most people. Reveal investigator Faith Abube explains.
Just 24 hours after the splashy headline on Forbes.com, and it's been taken down. The article had more than 500,000 views. It read, "The risk of exposure to COVID-19 in Georgia has increased by more than 40% since the state reopened for business." It was met with shock and confusion on social media. The Atlanta mayor used it to admonish groups who defied health safety measures this weekend in Metro Atlanta. But the governor's communications director retweeted a Kennesaw State University professor calling it silly.
That's not what it's measuring.
That professor is J.C. Bradbury, who has been following Georgia's number of COVID cases very closely.
There was absolutely zero evidence to support that, and the numbers that were provided didn't show it.
Emory University's infectious diseases specialist, Dr. Carlos Del Rio, also agreed.
I think the headline is very sensationalist.
In the article, the consumer tech writer uses the number of total COVID-19 cases per 100,000 people in Georgia and the daily newly confirmed cases to calculate Georgia's risk of exposure to the virus. A math the experts don't think shows exactly what the writer thinks it does.
Cumulative infection may not be the best measure. You actually want to measure active cases because really active cases are the ones that are transmitting. And that's the ones you worry about.
The math is completely incorrect. And certainly the more number of people who have the disease certainly increases your chance of transmission. But to then go from that to say our risk was increasing as that number was higher a week later is completely wrong, because that number has to go up. It can't go down.
As soon as 11 Alive reached out to Forbes and the writer for answers on the calculations, the article disappeared. The writer did send us an email explaining in part, quote, "Calling the metric I used a rate was an error on my part." He goes on to say, quote, "Incident rate is not the best measure. A better measure would be confirmed cases that are contagious, which would possibly eliminate those who have been cured."
I think it points to the danger of when we look at data to be careful as to what we are retweeting. I think the general message behind the article is that Georgia opening up increases people in Georgia to more exposure. That's obvious. I think that's very clear, and that's a correct statement.
We need to emphasize here is the risk of exposure is going to depend a lot on what you do, right? If you're using a mask and practice social distancing, your risk of exposure is going to be low.
And we have a more detailed explanation from that writer. We've posted his entire response in this article on 11alive.com.
Faith, I know you also reached out to the governor's office, Department of Public Health, and to Forbes. What did they have to say about all this?
That's right. A spokesperson told us, quote, "Forbes requires its contributors to adhere to strict editorial guidelines. The story did not follow those guidelines and was removed." We also reached out to the governor's office, and they say no comment now that that article has been deleted.
I did ask Mayor Bottoms about the article when we spoke earlier today. She said the thing that has not changed is that coronavirus still poses a real risk.
The underlying message is still there. Nothing has changed about COVID-19. And so whether it's you've increased your chances of 40% or you've increased them by 10%, nothing has changed about this virus.